Welcome to our podcast series this week, which will be all about the budget. And the NHS was a big winner, wasn't it, this time round?
Yes, I think we're getting £25.7 billion from the budget to help with the NHS.
And a lot of that money is supposed to be linked to reform, isn't it?
Yes, reform and I think productivity to help increase productivity.
Productivity is a weird concept, isn't it? Are you familiar with that?
I am, yes, I'm not sure how we're going to measure productivity because it's a tricky concept, especially given how big the NHS is. And I would guess, and I might be wrong, that it depends on your perspective and in terms of what you're looking for from the NHS.
Because productivity, say, for example, if you're making something, if you were to make a pair of glasses, then you think, okay, I'm going to spend an hour making these glasses and it costs me this much and therefore the glasses cost that much. So if I make 10 glasses in an hour versus 20, then I'm more productive for making 20. It's harder thing to pull off, isn't it, when you're looking at services? How does that work?
That's a very good question because I'm not too sure how we are measuring those productivity. Because right now in this setting where we are GPs, we can just say the total number of appointments we're giving out to patients in a week or in a month or in a year, whatever it is. So that could be an outcome or measurement, of productivity. But that may not be what the government is looking for. That may not be what the NHS is looking at either. Because even if you're making glasses, for example, in your analogy, it depends how good those glasses are. There's no point of you making 20 glasses compared to 10 if all those 20 are rubbish and poor quality.
Yeah.
So there's an element of quality to go with whatever output you're actually doing.
And there is that, in the formulas, we had a little quick look, didn't we, off the back of Professor Aradazi's report, looking at productivity with the formulas and stuff, which includes an element of patient feedback and outcomes as well.
Yes, and patient satisfaction, which is very important as well. Yeah. But we spent some time looking at it, and I think we agreed that we couldn't make head or tail.
So sorry, we can't work out this productivity stuff, can we?
We don't know what's going on.
But we're going to find out, aren't we, this week?
Yeah.
We're going to bring in experts and help you guys we'll learn with you on this little journey.
What you were mentioning about the appointments, like actually if you're looking at it and you're thinking of like a pair of glasses, you think that actually if I have more of those, or like, because everyone wants more appointments, you think, okay, well, maybe you're going to cut down on the time that you have with the doctor. So you think, the appointments. Yeah. But then, like you said, it's back to quality. What's happening during that appointment time? Are the patients leaving satisfied and, have a good experience?
Have they got good health outcomes? Because actually what you really want to do in the NHS is to work on prevention. So actually support people to not get ill in the first place. And then in that case, you're measuring something that isn't ever going to happen.
Exactly, because if you're looking at figures and you say, oh, actually, if I've got more appointments, then that surely must mean a better outcome, right? But is it? Because actually, if you're talking about prevention and preventing people from calling in and looking after themselves, isn't that a better outcome? But how do you measure that?
Can you tell me, the appointments data that we looked at earlier was interesting. Justin, do you want to give a little summary of the number of GP appointments over the last few years?
So I think, yes, Lord Darcy's report in one of the indexes appendices showed the average amount of appointments per month from 2017. And there was every year there was an increase. I think 2017 was 20.7 million appointments a month. And the most recent one from 2024 was 30.4 million GP appointments
per month.
That's a lot of appointments.
That's a lot of appointments. So, like Sarah said, we're not really sure what those 30.4 million appointments, in terms of measuring the health outcome, whether patients were left satisfied or unsatisfied. Because the other thing we looked at also from Lord Darcy's report was that patients were now saying that they were waiting longer for an appointment as well. So there is a lot of complicating factors and extra factors that needs to be taken into account that we hopefully will find some expert people to actually try to explain and break it down to us.
Sarah, you submit the returns for our practice. How does that work? What is an appointment?
What is an appointment? And I think that's come up quite a lot. Like in our practice, we do triage, and if patients are triaged, you're added to a list, but it's that could be a 2-minute appointment, but actually someone's gone in and they've looked through something, they might prescribe something. You won't capture that necessarily in that appointment slot. You have telephone appointments, you have video consultations, you have face-to-face appointments, and you have different times. You could have an appointment with someone for 30 minutes, an appointment with someone for 10 minutes. So, what is the average, appointment time? You have to make sure on the system that you've added the appointments correctly for then that data to show up, which has been a huge issue. You have group consultations. Yeah. Again, it's just about how do you add that onto the system? Do you add it as an appointment on the system?
And different healthcare professionals. So you've obviously got different roles within primary care. So does a GP appointment equal a physician associate appointment or a clinical pharmacist appointment, or
Yeah. We also we're open extended hours, and appointments are then put on on a hub on a different system. So again, how is that captured? So
could you share, just for people who may not be familiar, what a primary care network is?
Yeah, primary care network. So we work closely with practices in our area. So we have about 8 practices, and we kind of share resources. So we have, for example, a physiotherapist, clinical pharmacy team. And we kind of work together, we share that resource. I might have, for example, we run extended hours, so not all practices might be able to open on the weekend, but we then share appointments. So it's just about working together.
And what sort of people work in for the primary care network? Clinicians?
Clinicians, so we have physiotherapists, clinical pharmacists, physician associates. We have admin staff as well, so care coordinators, social prescribers, mental health and well-being workers, and mental health practitioners, loads of people.
And they all try to kind of work together, don't they? Yeah. So basically what we're saying is that there is some sort of really complicated formula, which I'm not entirely sure, none of us are entirely sure how that works. We might need to get a professor of economics in to explain it to us. But we will find out and we will share that with you. But in simple terms, I suppose, productivity is equal to, how effective or productive your member of staff is, I suppose, and the amount of resource that you have available to allow that person to be able to do their job. So can you think of ways in which you can support staff being more effective?
First of all, it's definitely a tough job. Given the demand, like we were just talking about, we're talking about billions of appointments per month, so you can imagine the impact it has on staff, and we know about demand and capacity. So, yes. So, what was your question?
How can you make people more productive? Do you say work harder, work faster?
Of course.
You're a manager, right? Isn't that your main job?
No. It's quite tough. You need to make sure staff are happy. You can, like you mentioned, technology. You can use technology using, we've done something called innovation labs in our practice, where we kind of get a group of staff together who may not necessarily work together, and give them time to kind of work on projects. So the things like, we're looking at diabetes, or maybe looking at TB screening, cervical screening, something that is kind of a huge kind of issue for us in general practice, and how we can do things a bit differently, because at the moment, it feels like you're just firefighting, and, we get hundreds and thousands of calls, and you don't really get time to step back and kind of explore different things. So we give staff time to work on different projects, think about how you can do things differently, and actually go away and test that and learn from it. And staff have enjoyed that. They've enjoyed, looking at different solutions and come up with really, really good ideas. And made a real impact as well.
You did something, didn't you, Justin? We also, all of us went, funnily enough, to the House of Commons to present our work, and everybody was in a little group, and sadly my group didn't win. It was your group that came through, wasn't it, Justin? Do you want to share what was so good about your innovation project compared to mine?
I can't remember what yours was.
Oh, mine was care planning.
Care planning, I see, okay.
See, that hurts. I don't remember his.
What was it?
It was TB and cervical screening.
Yes.
Which is,
I remember
quite frankly,
the ones I mentioned.
quite frankly, I don't remember what you did now, Justin. It was.
Yes, I mean, so we did specifically latent TB screening, because we know, especially in our part of London, I think we're the 4th or 5th highest cases of TB in London. And so the NHS did offer patients who are newly registered with GP practices who's newly arrived to the UK a chance to be tested for latent TB, which means that the patients have TB, but they're not infected or infective. And because we know from the research, latent TB patients tend to have an active flare 5 years down the line. So if we were talking earlier about preventative medicine, so this is a way of actually preventing further harm from happening down the line. And what we did as our project was for those new patients who registered and who were eligible to have TB testing, we offered it to them when they first joined the practice. And it was successful initially when we first did it, because we picked up a few cases where patients were found to be latent TB positive.
And from a productivity perspective, you looked at pathways, didn't you? So this wasn't a heavy technology-led project, but you had a massive impact off the back of talking to people, talking to stakeholders, working together, looking at the pathways, involving patients, involving staff.
No, exactly, because obviously when people think about TB, they think of the worst case scenario.
Yeah.
And there is a stigma attached to it. But yes, we took time to try to explain to the patients that, having the latent TB screen or being found to be positive with latent TB doesn't impact on their work, doesn't impact on their visa if they're on a visa. And yes, having the hospital team set up a TB service where we can refer patients quite quickly to that, that was really helpful as well. So everything was set up so that it could run a bit more smoothly. And yes, in terms of productivity, we took time to actually contact those patients and taking time to explain it to them. So like Sarah was saying, sometimes if you look on a piece of paper in terms of how you were doing that month, it may have seemed that we weren't doing a lot because we were contacting patients who didn't really have anything wrong with them, but we were trying to proactively prevent anything from sort of happening down the line.
And it's really interesting, actually, because if someone wants to measure your personal productivity as far as back to appointments, number of appointments, that would probably go down. But when you look at this project, which is actually a prevention project, as was the cervical smear testing, both of them are preventative things, but it wasn't you that did all those things. You had to support and understand what needed to be done, and the practice as a whole's productivity went up. And actually, neither of those projects, interestingly, involved technology, which is often people think, it's got to be some sort of tech solution or something. But actually, it's about people talking to people, which is.
It is, yeah. So you're right. So it's not just specific people in the practice; it's everyone in the practice, from doctors to the admin team to the nurses to the healthcare healthcare assistants. So lots of people were involved with the project. And yes, it wasn't really technologically heavy in terms of needing AI or chatbots or anything like that. But there probably is ways of actually making it more technology sort of friendly in terms of maybe sending text or having something in place where people can sort of find information. But because having that human interaction and explaining, because with TV, for example, is a big stigma attached to it. Breaking down those stigma, breaking down those barriers are useful. Yes,
Okay.
so but it's not something that happens,
And
and it's measured effectively.
and it results in quite good outcomes. Sorry, one of the other areas because we don't understand the formula in detail, which is I was laughing about a moment ago, because three of us just sat around looking completely confuzzled, looking at some formulas on
we
productivity.
need to bring it up on the screen so you guys can
One of the later on it'll all make sense. The other thing that, from a generic perspective, that is workforce, or supporting the workforce, and I think it's fair to say that we did a survey of staff and people happier, more engaged and stuff after they were involved in being able to work in groups of staff and groups of patients. One of the other areas that people talk about from an economic perspective is capital productivity. So premises. Primary care, it's a lot of practices are operating from houses, aren't they? And we've got our own challenges as well. Do you want to share some insights?
We're quite a large practice, and we were talking about having PCN staff who can support us, but one of the issues we have is lack of space. You guys can't see, but if we were to turn the camera, we have our office space there, and you've got 9 computers rammed in there. And you try to work, and we've got a pod behind Justin, where he usually sits, and it's a struggle to just.
We have to ask him to move
to
open the door.
So yeah, we've put in pods in the practice to kind of help with space, so you can have like a consultation where you're not using a room. So we try and use our rooms only if we're examining a patient. But yeah, space.
Yeah, doctors work in reception, and now we're planning to move staff into the waiting room, aren't we?
Yeah.
Because we just haven't got any space.
We don't have space, but at the same time, I think that kind of we're talking about productivity, and a lot of the time people might come into work and you kind of go into your room and you stay in that room the whole day. It's quite depressing. You feel a bit lonely. So actually people working out might help that. And actually you can speak to people around you. A lot of the time, if there's a quick message or something that comes up, rather than having to, reply through your computer to someone who's just sitting probably in the next room, you're there next to each other, you can just ask and it's kind of just dealt with. You probably understand situations a bit better, like our doctors can hear the conversations that our, care navigators are having. The clinical pharmacist will be sitting next to you. They might have, you might have a query about prescription, you just need a quick answer, and they can just answer you rather than you having to send an email, send a task.
But some people don't like working in that environment, and that's kind of okay too. You can work in a pod or work in a room or something.
If we have one.
Yeah, if we have. No, often actually we just simply don't have rooms.
Have space. Yeah. So yeah, it's tough. I mean, it worked out during COVID. We were able to work from home But
now I think people want to come back
to
patients want to be seen, don't they, face to face? Ideally, that's the overall drive. I think something small, then that's fine, and we use a bit of technology and stuff. So it's a huge challenge for us in primary care and secondary care, and beyond our practice. I think a lot of GP practices are operating from houses, and they've been adapted and make the best of what they can, but end of the day it's not really fit for purpose. And just last little thing actually, Justin, from the technological perspective. So a big chunk of productivity is around doing what you've described, but also looking at technology. Everyone's talking about AI this and AI that. Any thoughts on the impact of artificial intelligence on NHS productivity in primary care or secondary care?
Possibly. I think this was talked about sort of 5 years ago with AI, and specifically helping in dermatology, sort of skin conditions. Because it's all about pattern recognition and knowing the sort of signs of sinister things and not sinister things. And there was a thought that with AI tools to sort of recognize, is this skin cancer, is this not, that could free up some work from primary care, but it's not something that's going to happen tomorrow or even next year. So there possibly is a sort of avenue for AI in helping specific things like that. But we don't really know, because AI is always, especially machine learning, is always evolving, and there's so many things involved, and it's obviously not my expertise, but it may help.
But
we
it's
don't really know.
so things are changing so quickly, though, aren't they? From like almost from month to month. I think you're right. I think there's a whole heap of risk around clinical diagnosis, and that's where the greatest risk is. And I think we need to have the adequate safeguards in place ahead of that kind of. But from a supportive perspective, say for example, transcription, which means writing down your notes from what you say into the medical notes, save you typing it. That's something that's increasingly sort of apparent. But then again, you've got to check that there are issues around that, aren't there? Do you want to share what your...
I thought, yeah, so with the sort of AI services that help write patient notes or put it into patients' notes, the main issue, it's not that I have with it, but one of the main issues I can see is that if things were documented incorrectly and not sort of checked properly, it's put down in patients' notes, it could lead to sort of litigation if something was put down incorrectly, and that could be used as a example of something's gone wrong, or even if things are noted down and coded incorrectly, that would lead to patient distress, patient harm, because they were giving them medication that they didn't really need to have, because with medication there's always benefits and risk, and if there's no benefit of you taking a medication and being supplied to you, that's not a good thing to have.
Yeah, I think that there's a trade-off, isn't there, between like having to read word for word what you've said in the conversations versus having an AI summarize that, but then it might put stuff in there that wasn't said. But having said that, one of the practices nearby has tested this and they absolutely love it. So yeah, wait and see. So from an admin perspective, in my mind, I think it lends itself a lot more to admin side, doesn't it? Because there's less clinical risk around that.
Exactly. I think there's a lot of things that can be automated or put into workflows. We have to deal with like clinical letters, even actually just patients coming in. We have a robot, which is a very sad robot. But I mean, you could, taking patients to their rooms, and they can actually input things and get them to check their own, readings on, I don't know, checking different.
We have to put this robot to work.
We do need to figure out. Yeah, I'm sure it could do loads. But yeah, I think there's a lot. It's just about, again, taking that step back, looking at processes and seeing what you can automate.
Cool. All right then. Well, I think that's a first sort of start to our week of productivity.
Not knowing what it is.
We don't quite know what it is, but we'll learn with you along the way. So I think that was a fairly productive podcast, wasn't it?
Yeah. All right, let's get back.